Up to this day, we treat depression according to monoamine theory. We believe that depression is caused by deficiency of neurotransmission, which can be caused by low levels of serotonin and norepinephrine and to a lesser extent dopamine in the synapse. So we believe that depression is caused by decreasing amount of serotonin and norepinephrine in the synapse. So how to treat depression? The most obvious approach is to increase the amount of serotonin and norepinephrine in the synapse. And drugs that cause increase in serotonin or norepinephrine in the synapse we call antidepressants. Monoamine oxidase inhibitors can be divided on two classes, selective and non-selective. To non-selective monoamine oxidase inhibitors belong phenylcypramine, phenelzine, and isocarboxazide. To selective monoamine oxidase inhibitors belong selegiline and rasagiline. Monoamine oxidase inhibitors have three mechanisms of action. First of all, by inhibition of monoamine oxidase B, they can increase the amount of norepinephrine in the synapse. And to explain this, we have to know how adrenergic neurons work. So we have presynaptic neuron, synapse, and postsynaptic neuron. Adrenergic neurons uptake tyrosine. Once tyrosine appears inside the neuron, tyrosine undergoes hydroxylation by rate-limiting enzyme tyrosine hydroxylase with formation of L-DOPA. Then L-DOPA by DOPA decarboxylase is converted to dopamine. Once dopamine is formed, vesicular monoamine transporter puts dopamine inside the vesicles. In the vesicles, dopamine molecules undergo conversion to norepinephrine, and in this form, norepinephrine is stored inside the neuron. But once depolarization occurs, neuron pushes vesicle into the synapse. We call this process exocytosis. As a result, vesicle becomes destroyed, and norepinephrine molecules income to the synapse. On postsynaptic neuron, we have numerous adrenergic receptors. It's alpha-1 receptor, beta-1 receptor, and beta-2 receptor. Once norepinephrine molecules appear in the synapse, most of them immediately bind to adrenergic receptors. With binding, they activate adrenergic receptors, and activation of adrenergic receptors improve mood and increase energy. Some of the norepinephrine molecules bind to alpha-2 receptor on presynaptic neuron, which is autoreceptor. With activation, this receptor inhibits the exocytosis of norepinephrine vesicles into the synapse. So this receptor provides reciprocal regulation. But what happens to norepinephrine molecules that simply did not have time to bind to any receptor? On presynaptic neuron, we have norepinephrine transporter called NET. This transporter uptakes free norepinephrine molecules and delivers them back to the presynaptic neuron, where the big bad boy monoamine oxidase B waiting for them. Most of the delivered norepinephrine molecules have a tragic fate. Monoamine oxidase uptake and destroy them. But some norepinephrine molecules are able to slip away from monoamine oxidase, and such molecules income to norepinephrine molecules inside the vesicles, thereby replenishing norepinephrine pool. Monoamine oxidase inhibitors, by inhibition of monoamine oxidase, block the degradation of norepinephrine. With decreasing degradation of norepinephrine, norepinephrine molecules can go into the vesicles. Thereby, this causes increase in total norepinephrine pool. The higher the amount of norepinephrine molecules in the vesicles, the higher the secretion of norepinephrine into the synapse. And with the increasing amount of norepinephrine in the synapse, the stimulation of adrenergic receptors increase, and thereby, potentially, the better becomes the mood and the more energy increase. So, with inhibition of monoamine oxidase B, degradation of norepinephrine decrease. This causes increasing amount of free norepinephrine molecules in presynaptic neuron, thereby the release of norepinephrine into the synapse increase. And the greater is the amount of norepinephrine in the synapse, the greater is the adrenergic effect, and thereby the better becomes the mood and energy increase. But also, inhibition of MAO-B results in increasing amount of dopamine in the synapse. And to explain this, we have to know how dopaminergic neurons work. So, we have presynaptic neuron, synapse, and postsynaptic neuron. Dopaminergic neurons uptake tyrosine. Once tyrosine appears inside the neuron, tyrosine undergo hydroxylation by the rate-limiting enzyme tyrosine hydroxylase with formation of L-DOPA. Then L-DOPA by DOPA decarboxylase is converted to dopamine. Once dopamine is formed, vesicular monoamine transporter puts dopamine inside the vesicles, and inside the vesicles, dopamine is stored inside the neuron. But once depolarization occurs, neuron pushes vesicle into the synapse. We call this process exocytosis. As a result, vesicle becomes destroyed, and dopamine molecules income to the synapse. On postsynaptic neuron, we have numerous dopaminergic receptors. Once dopamine molecules appear in the synapse, most of them immediately bind to dopaminergic receptors and activate them. Some of the dopamine molecules bind to dopamine autoreceptor on presynaptic neuron. With activation, this receptor inhibits the exocytosis of dopamine vesicles into the synapse. So this receptor provides reciprocal regulation. But what happens to dopamine molecules that simply did not have time to bind to any receptor? On presynaptic neuron, we have a dopamine transporter called DAT. This transporter uptakes free dopamine molecules and delivers them back to the presynaptic neuron, where the big bad boy monoamine oxidase B waiting for them. Most of the delivered dopamine molecules have a tragic fate. Monoamine oxidase uptake and destroy them. But some dopamine molecules are able to slip away from monoamine oxidase, and such molecules income to dopamine molecules, thereby replenishing dopamine pool. Monoamine oxidase inhibitors, by inhibition of MAO, block the degradation of dopamine. With decreasing degradation of dopamine, more dopamine molecules can go into the vesicles. Thereby, this causes increase in total dopamine pool. The higher the amount of dopamine molecules in the vesicles, the higher the secretion of dopamine into the synapse. And with increasing amount of dopamine in the synapse, the stimulation of dopaminergic receptors increase, and thereby, potentially, the better becomes the mood and the more energy increase. So, with inhibition of monoamine oxidase B, degradation of dopamine decrease. This causes increasing amount of free dopamine molecules in presynaptic neuron, thereby the release of dopamine into the synapse increase. And the greater is the amount of dopamine in the synapse, the greater is the dopaminergic effect, and thereby, according to monoamine theory, the better becomes the mood and the more energy increase. Non-selective monoamine oxidase inhibitors also block MAO-A, which cause increasing amount of serotonin molecules in the synapse. And to explain this, we have to know how serotonin neurons work. So we have presynaptic neuron, synapse, and postsynaptic neuron. Serotonin neurons uptake tryptophan. Once tryptophan appears inside the neuron, tryptophan undergo hydroxylation by rate-limiting enzyme tryptophan hydroxylase, with formation of serotonin. Once serotonin is formed, vesicular monoamine transporter puts serotonin inside the vesicles, and in this form, serotonin is stored inside the neuron. But once depolarization occurs, neuron pushes vesicles into the synapse. We call this process exocytosis. As a result, vesicle becomes destroyed, and serotonin molecules income to the synapse. On postsynaptic neuron, we have numerous serotonin receptors. And once serotonin appears in the synapse, most of them immediately bind to serotonin receptors. With binding, they activate serotonin receptors, and activation of serotonin receptors improve mood and increase energy. Some of the serotonin molecules bind to serotonin 1 beta receptor on presynaptic neuron, which is autoreceptor. With activation, this receptor inhibits the exocytosis of serotonin vesicles into the synapse. So, this receptor provides reciprocal regulation. But what happens to serotonin molecules that simply did not have time to bind to any receptor? On presynaptic neuron, we have a serotonin transporter called SALT. This transporter uptakes free serotonin molecules and delivers them back to the presynaptic neuron, where the big bad boy monoamine oxidase A waiting for them. Most of the delivered serotonin molecules have a tragic fate. Monoamine oxidase uptake and destroy them. But some serotonin molecules are able to slip away from monoamine oxidase, and such molecules income to the newly formed serotonin molecules, thereby replenishing serotonin pool. Non-selective monoamine oxidase inhibitors, by inhibition of monoamine oxidase, block the degradation of serotonin. With decreasing degradation of serotonin, more serotonin molecules can go to the serotonin molecules in the presynaptic neuron. Thereby, this causes increase in total serotonin pool. The higher the amount of serotonin molecules in the vesicles, the higher the secretion of serotonin into the synapse. And with increasing amount of serotonin in the synapse, the stimulation of serotonin receptors increase, and thereby, potentially, the better becomes the mood and the more energy increase. So, with inhibition of monoamine oxidase A, degradation of serotonin decrease. This causes increase in amount of free serotonin molecules in presynaptic neuron, thereby the release of serotonin into the synapse increase, and the greater is the amount of serotonin in the synapse, the greater is the serotonin effect, and thereby the better becomes the mood and the more energy increase. The major drawback of monoamine oxidase inhibitors is the significant amount of very dangerous side effects. Probably the most famous side effect of monoamine oxidase inhibitors is the so-called cheese effect, which is provoked by ingestion of tyramine-containing food. So let's explain the pathogenesis of this side effect. We have some amount of tyramine in our organism. The specific feature of tyramine is the ability to induce the release of norepinephrine from the presynaptic neurons. And once norepinephrine molecules are released, they search for adrenergic receptors on postsynaptic neuron. And once they find them, they immediately bind, and this binding of norepinephrine causes activation of adrenergic receptors. With activation, they induce vasoconstriction, and also they increase heart rate. The level of tyramine is regulated by monoamine oxidase. In this case, let's take monoamine oxidase A. Monoamine oxidase A constantly uptakes tyramine molecules and destroys them. So it's a normal pathway of tyramine. But if we prescribe non-selective MAO inhibitors, now the function of MAO becomes compromised. And if monoamine oxidase is not working, now the degradation of tyramine becomes impossible. As a result, the level of tyramine increases. The higher the tyramine level, the higher the release of norepinephrine from the presynaptic neuron, and the higher the amount of norepinephrine molecules in the synapse, the stronger is the stimulation of adrenergic receptors, and thereby the stronger is the vasoconstriction and the higher becomes the heart rate. Also recall that blood pressure is equal to cardiac output on systemic vascular resistance, and cardiac output is the stroke volume on heart rate. With more severe vasoconstriction, systemic vascular resistance increase, and with increase in heart rate, cardiac output increase. As a result, blood pressure increase, so hypertension develops. But if patient is a little bit posh, and he decided, in addition to this, to eat some processed meats, aged cheese or red wine, now it becomes interesting, because all these products contain a great amount of tyramine. So now dietary tyramine comes to the organism, so total tyramine level becomes even higher. The higher the tyramine level, the higher the release of norepinephrine from the presynaptic neuron, and the higher the amount of norepinephrine molecules in the synapse, the stronger is the stimulation of adrenergic receptors, and thereby the stronger is the vasoconstriction. With more severe vasoconstriction, systemic vascular resistance increase. And also, the higher becomes the heart rate, and with increase in heart rate, cardiac output increase. As a result, blood pressure increase even further. So, intake of dietary tyramine can provoke not just a simple hypertension, but the entire hypertensive crisis, with increase in blood pressure, with increase in heart rate, with severe headache and with nausea and vomiting. But important that selective MAO inhibitors as selegiline will not cause cheese effect, because they block only MAO B, but MAO A in this case will not be affected. So in patient on MAO inhibitors, ingestion of tyramine-containing products as aged wines, beer, aged cheeses, and cured meats cause increase in release of norepinephrine, and with increase in amount of norepinephrine in the synapse, hypertensive crisis can develop. We call this cheese effect. But important that selective MAO inhibitors as selegiline do not cause cheese effect, because in this case MAO A is still working. The second important side effect is serotonin syndrome, which is caused by increase in amount of serotonin molecules in the synapse. Because monoamine oxidase inhibitors cause increase in amount of serotonin in the synapse, they can cause overstimulation of serotonin receptors, and overstimulation of serotonin receptors can cause serotonin syndrome. But if patient intakes just MAO inhibitors, the chance of serotonin syndrome to develop is relatively small. But if we prescribe MAO inhibitors in combination with selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, or tricyclic antidepressants, now it becomes dangerous, because all these drugs block the function of serotonin transporter, and with blockage of SERT, the reuptake of serotonin becomes disrupted, so more serotonin molecules will stay in the synapse. With increasing amount of serotonin in the synapse, the stimulation of serotonin receptors increase, and now with such overstimulation of serotonin receptors, the chances of serotonin syndrome greatly increase. Serotonin syndrome manifests with hypothermia, muscle rigidity, myoclonus, and also it can cause rapid fluctuations in the mental status and vital signs. So we have to remember that prescription of MAO inhibitors with selective serotonin reuptake inhibitors or tricyclic antidepressants greatly increase the risk of serotonin syndrome. In addition to this, we have other substances that can cause increasing amount of serotonin in the synapse, and they all are contraindicated in patients on MAO inhibitors. Moreover, we have to wait 2 weeks after stopping of MAO inhibitors before we prescribe other serotonergic drug, as selective serotonin reuptake inhibitor for example. And in these 2 weeks, patient should not consume tyramine-containing products. Because of a great amount of side effects and drug interactions, nowadays MAO inhibitors are not used as a first-line therapy. We use them as a second or third-line options in atypical depression, for social and generalized anxiety disorders, and also in Parkinson's disease we use selagelin, which is a selective MAO inhibitor, but the first-line option in Parkinson's disease is levodopa.